Welcome back. In the last episode, we did promise that we'll be showing you the right technique for brushing your teeth. So, Prof, show our viewers how to brush properly.
Thank you very much. I'll start with the essentials.
Okay.
You need a good toothbrush. I told you what a good toothbrush should look like. It should have vertical tops and the bristles. Then toothpaste of your choice. You take a pea size of it and express it on the toothbrush, the head. Then you need a glass of clean water.
Prof, did you say pea size, peanut size?
Peanut size.
That small?
Yeah, that's okay.
Oh.
That's okay. It's not that you must express it like some will just start from the beginning to the end. Except you want to make the toothpaste make us rich. So a clean glass of water, then an understanding of what you want to do. What you want to do is to clean all the surfaces, both the upper and the lower, the right and the left side. You want to clean all the surfaces. And the teeth, you can see you have the outer surface, you have the inner surface, then you have the what we call the occlusal surface or the biting surface. So every of these surfaces have to be clean. And you have to do it methodically. You have to do it in a very, very effective way. Let's start from the top, from the upper side. So from the upper, and we are starting from the left. Now, you angle your brush at 45 degrees, okay? And you start to brush in a sweeping motion. You engage it, and then it's as if you are sweeping. About 3 or 4 strokes is okay for a segment of about 3 teeth. Then you move to the next 3 teeth, you do the same. We are doing the outer side now. Then you go to the inner aspect. Then you repeat the same, about 3 or 4 strokes, you move again, then the inner, then the outer. So you have done that for one side. You move to the other side, which is the right side now. So you do that outer, inner, upper teeth, you brush it down. Then you go to the lower teeth. Lower teeth, you brush it up. The same technique that we use for the upper, you use it back teeth.
From the gum to the tooth.
From the
right?
gum to the tooth.
Okay.
Then the inner, you do the same until you get, then you move to the other side and you do all those things. You are not done yet because you have to brush the occlusal surfaces, the biting surfaces. So you brush them. You can brush this side harder because they may contain some things that you need to remove. So you can brush them, the 4 surfaces, you brush that. Okay? At this point in time, some of the water are the things they are gathering in your mouth so you can spit out. You are not done yet. Then you now brush the tongue. The tongue is, yeah, you brush the tongue outside. You should, brushing your tongue is part of cleaning your mouth. So you brush out the tongue, take a glass of water again, you rinse your mouth, and then you rinse out, and you are done. In about 3 minutes, you will have finished cleaning all the teeth. And you do that after breakfast, and then in the night before you retire. So that is the technique that you do. And if you continue like this, you'll be able to remove all the plaque from time to time on a daily basis.
Oh, that's amazing. Thank you so very much. Wonderful indeed. Now, something that was very, very interesting is I noticed that you didn't teach this motion that most people do.
Yes.
There's sometimes this other motion. Why is that?
In fact, from the demonstration you are doing, I can see that the strength with which you are doing this thing. It appears that, and we want you to relax when you are brushing, so that you are not tensed up. Those motions, they actually injure the gum and wear out the teeth. What we call toothbrush abrasion can abrade your teeth. It is not fight. The teeth that you want to remove, they are microorganisms. They are not that attached, except maybe it has become hardened, and that will be left for the professionals to remove. So just gently angle it and sweep them away. That is what we are doing, okay? That motion of brushing the teeth, you're actually packing some of these food particles inside in between the teeth. You are not
Okay.
removing them.
Okay.
So it's a wrong technique.
Okay.
And that we don't want to teach you the wrong technique.
Okay.
So that's why we say it's technique sensitive. You know what you want to do is to remove the plaque from the tooth surfaces, and this has been proven to be the best means of removing the plaque.
But some people say that this is how I've been brushing all my life. How do I not change that now? You know?
Yeah, and that is why if you are be doing a wrong thing and you see a new way, you have to learn. You have to learn. Active learning. You have to learn to see you change to that new way, and that's what we are here to tell you about.
Absolutely. That's so wonderful. All right, now, so having dealt with that, we'll be taking a look at the next step of this, secondary care. Now, let's say an individual has now gotten either dental caries or a periodontal disease. He now needs to see a professional. All right, that's basically what we're talking about, secondary care. So in the instance of dental caries, what should and how would the patient now, what's supposed to do? At what point does the patient go to the dentist, and then what should be expected for secondary preventive care?
Thank you so much. Like we earlier noted, you see, I had said that for every person, as long as you have started growing your teeth, you should have regular dental checkup, with your dentist. You don't need to wait until there is an issue before, because once we have often said that we tend to categorize different people under different risk. For those, we have low, middle risk, and high risk people. That I don't want to go into the details of that, so that for the very high risk people, we say, okay, come as often as 3 months, every 3 months for checkup. For the low risk, 6 months monthly, you can come, yes, twice a year for checkup and the rest of that. But what I'm trying to say in essence is that you should form the habit of having regular checkup. It is better for the dentist to tell you there's no problem than for you to sit back at home until because by the time you are feeling the pain, it may actually have progressed to a reasonable extent, and that we may now need to intervene, and sometimes it may be too late for us to even save the tooth, that the patient needs to now lose the tooth. So at what point does the patient come to the clinic? Every time come for checkup. But once you start to have shocking sensation, once you have to feel shock, something is wrong. There's a problem with your teeth. The dentin, which is the most sensitive part of the teeth, is exposed. Come to the hospital. And when we check and we find out that there is a hole, we assess the extent. Sometimes people come with multiple cavities in the mouth, not just one, so many. Then you begin to do the risk assessment for that patient. You want to know exactly what is this person exposed to. That brings us to dietary assessment for this patient. Because dental caries have been known to be caused by certain food items, commonly sweet things, sweet sugary substances, refined sugar, and the rest of them. You do not provide, or you do not intervene or treat a patient without some level of education on how to prevent further occurrence of what you are treating. So that's why it's important that before you treat the patient, find out what are the patient's habits. Does the patient snack a lot, take soft drinks, sweet, sugary substances, cake, and the rest of them? The patient may need to cut down on that. Because haven't intervened or treated the cavity or the hole, you do not want the patient to go back to the old habits, which of course will result in further cavities coming. So when the patient comes, we assess, and having educated the patient on dietary advice to prevent or forestall recurrence of such cavities, you want to also know the level or the depth of that cavity. Do you understand? The depth of the cavity, and then you take it from there, that you are going to just fill directly, or you are going to temporize, make it to achieve some level of treatment before you now feel permanently, or sometimes it may just have gone straight into the pulp, the living part of the tooth.
And then you
that
now have
will take-
advanced
advanced,
procedures.
procedures carried
Okay.
out to restore the cavity.
Amazing, amazing. We'll be continuing on this, but that will be when we come back. Welcome back. We were talking with Dr. Harrison, and you were educating us about what's the patient's and how the patient needs to get to the dentist on time when he has some symptoms and so on. Just continue.
Yes, so like I said, so the patient comes with a pain and to the dental clinic, and we find out that there's a cavity, or there are multiple cavities, what we refer to as rampant caries, as in the person is having so many of them. The important thing, like I said, you need to find out before you intervene. Why is this person having a lot of this? So that you would have done during your history taking, during our normal interaction with the patient. And so you, depending, like I said, on the depth of that cavity, on how much damage has gone to the tooth, different treatment options are available for the...
Like the ones you highlighted
Yes,
earlier on with us. All right, that's absolutely wonderful. Well, I want to throw in something from here, what he was talking about. He talked about modulating diet in terms of refined sugar and what people take. Because I know that some people are sweet tooth. They like cake a lot, they like ice cream a lot. Does that mean that you just ban them from taking ice cream and taking cake and all those kind of things? What? How do we still enjoy?
Thank you. Everybody likes sweet things. To make better life, life is sweet. Enjoy it. No, you don't have to just ban and then not take any sweet thing. What is important here is you know when to take it and what type to take.
Okay.
What we are concerned about is refined sugar.
Okay.
Sugar that is processed in the factories and incorporated in sweets, in biscuits, in cakes, and in carbonated drinks. That's what we are concerned about. And again, the time with which you take this before cleaning your teeth also matters. The frequency with which you take this matters, and then the cleaning habit also matters. If you take sweet substance now, and you clean your teeth effectively immediately after, it won't lead to this dental disease.
Because you've removed the substrate, and so the bacteria doesn't have, the organisms don't have any substrate to act on.
If you are prepared to take sweet things, be prepared to also clean your mouth frequently, more frequently.
Okay.
But by and large, we also have other sweet things that are natural, like fruits.
They contain some sugar. Not easily.
Yes, not that carcinogenic as the one that is refined.
Okay.
So we prefer that you take sweet, like fruits and all those things. Aside from that, we also have what we call sugar substitutes.
Okay.
They are sweet, but they are not carcinogenic. An example is xylitol.
Okay.
And it's a sugar alcohol that is incorporated in sweets, or even sweets and chewing gums and cake. You would think it's sweet, but it doesn't cause dental caries. The only thing is that they are more expensive than the normal ones that you have. So there are leeways about this. If you have the knowledge of it, you know what you are taking, you can actually still continue to take sweet things in quotes, but they are not really causing the disease the way we look at it.